As many of you know, in health coaching and beyond, we mix up conversations between the two of us, chewing over hot topics, latest news and emerging ideas, but also bring you conversations with thought leaders and people we admire in the field of health coaching and beyond. This week, I'm talking to Dr Callum Leese, a GP in Scotland, working part-time also at the University of Dundee, doing research with population health. He's passionate about people and the empowerment of individuals to improve their own mental and physical well-being, which comes across well. He is a co-founder of the community-led initiative Healthiest Town in Aberfeldy. Physical activity is one of the most powerful interventions we have, yet it's still one of the hardest to embed in everyday healthcare. So what's getting in the way and what might we be missing? I hope you enjoy this episode with Callum, who is also a husband and father of two. Hi, Cal. Thank you so much for joining us on our Health Coaching and Beyond podcast. It's delightful to have you on. I just wonder, for the people who don't know you, have not met you yet, and there may be a few people, if you could introduce yourself, just maybe you could share a little bit in terms of what's going on for you right now. And then, of course, we'll track back and find out kind of how you've got to this point. But yeah, Cal, introduce yourself to folks.
Yeah, of course. Yeah, thanks so much for having me on the pod. For those that don't know, I'm a GP based up in the Scottish Highlands in a little town called Aberfeldy. So I do that a couple of days a week, and then the rest of my week is split between doing some research at the University of Dundee into physical activity and lifestyle predominantly, and then also along with Hussein Al Zubaydi, who I think just about everybody knows and has been on this podcast before. I'm the champion for physical activity and lifestyle at the Royal College of GPs.
Yeah, great. And you also have your own podcast as well, Cal, with Hussein, I think, as well.
Yeah, that's right. Yeah, Hussein and I and another close friend, Susie, have a podcast called The Movement Prescription, where we try to encourage our fellow health professionals to talk about physical activity with people of various health conditions.
Great. Fabulous. So I'd love to kind of find out a little bit kind of how you've got to where you are now, because it sounds really interesting, all the things you're involved in. But yeah, just share a little bit, wherever you want to start, Cal.
Yeah, of course. Well, I think with all these things, there's probably a lot of prejudice, and I grew up in a very active family and was always incredibly active. So, I kind of approached this from a fairly biased perspective, but it was probably particularly during my GP training, Tim. I was in Aberfeldy, where I'm now working during my training, and noticed during COVID that obviously there was a huge impact of the disease itself, but possibly what we noticed even more in our community was the secondary impact, particularly those kind of non-communicable diseases, the increase in blood pressure, cholesterol, and often these things were in some capacity linked to lifestyle. I use the word lifestyle kind of cautiously, maybe reluctantly. I think sadly it's loaded with connotations of blame, and I don't mean it that way. I think an understanding of the social determinants is really important, but for lack of a better word, it's what we use and are stuck with. So acknowledging that, and almost, not despair would be the wrong word, but it very much felt like we were practicing whack-a-mole medicine, for want of a better phrase. And I know Hussein has used that. I don't know if he used it in his episode, and I'm sorry for those that are listening if it's repeated, but it just felt like we were waiting for someone's health condition to be bad enough that we could make a diagnosis, to then throw medication at it and just wait for the next kind of condition or issue to crop up, rather than going upstream and addressing the real determinants. So in light of that, we or on the back of that, and with some amazing colleagues, and I can't take much credit, but we set up a charity in our local community to try and make it the healthiest town in Scotland, and it's called Healthiest Town Aberfeldy, which is all fairly grandiose, but really the intention is to remove as many barriers in the community to good health that people face. And that really got me on the path of being interested in preventative medicine. So I ended up getting an academic post at the university. I had a secondment to the WHO for Europe in Copenhagen to do some work with their non-communicable diseases team. And kind of have remained in that space ever since.
Wow. So, I mean, there's so much there I kind of want to pick up on. I mean, I did go and look at the kind of the Aberfeldy, the Healthiest Town Aberfeldy. I did look at the website, and there's so many great stories on there. But I just wonder where are you up to now? How's that developed? Cal?
Yeah, it started out as a real passion project for a few of us, very ad hoc, informal, uncoordinated, and it's kind of growing, or it has grown pretty substantially over the last 3 or 4 years. So we registered as a charity. We have a program manager who delivers a series of events, and we've got someone who leads on comms as well. So, probably a lot of our focus is around food. There's a bit of a legacy in our town, and uh, one of the retired GPs, I was actually got it here. I was clearing out our office for it being painted, and a GP in the 1960s wrote a series of essays about ultra processed foods. This is in 1962. How incredible is that? So there's a bit
Wow.
of a legacy of sustainable eating within our community, and we've jumped on that legacy, and we kind of have lots of events, whether it's kind of cooking classes for locals, whether it's growing groups, or we have a growing festival that's been a week the last few years, but it's over weekends this year. We have community Kaylee, yeah, and do quite a lot of work with schools. So yeah, it's an ever evolving project. It has its challenges, like all these things do. But yeah, it's a wonderful thing to be involved in.
Yeah, and again for those who've not made their way yet to that website, it's great to kind of visit there and see the videos again. You live in there's such amazing surroundings, isn't there, as well for people to get out in.
Yeah, it's a really interesting point, Tim, because we live in my opinion, it's just a beautiful part of the world, one of the most beautiful parts of the country. Uh, it speaks into this rural inequity, and I think often we think about inequity along social inequity, but there's a rural inequity as well, and actually within lifestyle it's really interesting because of the challenges that presents. And so you know, despite the fact we live in the most beautiful part of the country, there's very little activity built into our days because we can park in our driveway and we can park right outside of work. And so when you're having communications, or chatting to patients, or whoever it might be, when you're trying to frame physical activity, it's maybe a slightly different approach that you take in an urban setting where you can kind of build it into your daily commute, for example. So you're kind of almost selling a slightly different product, and it's the same with food. We have in Aberfeldy, we've got one co-op in the town, which is kind of the major shop, and the other big chain supermarkets. So I won't name brands, but they're about an hour away, and so it does mean that if you're not planned, or you're kind of slightly more ad hoc with your shopping, it's a bit more expensive because the foods in that are available in Aberfeldy cost more, and that was a particularly acute challenge when the co-op was hacked. Was that last year? And the shelves were empty. So yeah,
Yes.
it's beautiful, and that comes with amazing opportunity and also some challenges.
Yeah, and actually, I had not considered that. So yeah, thanks for sharing that insight. Because again, I know we kind of talk about the easiest way to kind of be active is absolutely to kind of plan it into your day rather than be something extra that you do at the end of the day or somehow in the middle of the day you try and fit it in. Yeah, that's really interesting because I noticed some of the stories there were for people who had done had started walking, and there were people who managed to lose quite a lot of weight that must have paid attention to their diet as well for that, and then the cold water swimming and things. So some really inspirational stories that were there.
Yeah, we got a brilliant community, and lots happening, and it's been really fun to kind of tap into that and use people's journeys to inspire others. And so one of the things we did do is we created a 25-minute video for the waiting room, and it was of 6 individuals talking about the changes they'd made to their life to kind of try and be more healthy, and it kind of intermittently plays on repeat in the waiting room, and it's just recognizable faces in the community, and hopefully it's tangible as a consequence, as opposed to people seeing something that's maybe unrelatable to them.
Yeah, it's all very well, isn't it, for us to kind of, as healthcare professionals, to kind of sit and kind of give people advice or even suggest things, and but actually, when people can see people who are like them doing things in their area, that makes a big difference. I imagine. I imagine.
Yeah, I think this is something I've wrestled with, Tim, is as someone that's really active myself, am I the right person to be advocating for physical activity? And the answer I've come to is yes, but I think that you're damned if you do and you're damned if you don't, because on the one hand, people might find you unrelatable, and on the other hand, if you're not active, then people will think, well, why should I listen to you? And so, yeah, and that's maybe that's where the kind of health coaching and the nuance in the training that you provide comes in. I think is being able to tap into the psyche of people and not alienate, or you're really hit home with your messages when you do have those opportunities.
Yeah. It's really interesting, and I was wondering a little bit about that in terms of how I suppose in some ways we know physical activity is really, really important, and yet we know that lots of healthcare professionals find it really difficult to kind of include that or even go there. And I just wondered, what do you think are the obstacles to that?
In some of the research I've done, almost every health professional acknowledges the value of physical activity for both prevention and treatment of disease, and that's fairly unequivocal, really. And despite that, there's quite a big disconnect between that then being implemented in clinical practice, with lots of people unable to do that. Why is that the case? You know, the barriers are fairly self-evident, and probably the biggest of them is time. So yeah, or a lack thereof. There was a really great paper in the BMJ that was at the kind of in January 2025 by Johansson and colleagues, talking about sacrificing patient care for preventative health. I'm not sure if you ever read it, but they write this really interesting paper which talks about the ever increasing demands placed on GPs' time. And they say what is happening is we're trying to squeeze more and more in, and what things are being missed. We're asking too much, and it's basically the demands we put on healthcare professionals' time's unachievable, and it's leading to moral injury. It was a really interesting piece,
Mm.
and I think it definitely resonates. And so, I suppose that's why it's happening. What's the answer is the next question, and I think uh, I think there are lots of opportunities, and I don't think we should beat ourselves up too hard in the UK. I think I was just off a call this morning with someone from Australia, and she had come to the UK because we are perceived as world leading in social prescribing, for example.
Wow.
And so yeah, I think that was really reassuring to hear. I think we're very good in the UK at at maybe not kind of recognizing our strengths. So yeah, and that's definitely one. That's definitely an area of opportunity. Uh, yeah.
Yeah. And
Mhm.
so time definitely one. I can definitely see that. It's like how many things can you fit into your 10 minutes or your 15 minutes or whatever
Mhm.
time you've got. And yes, the worry is that then you know they might miss other stuff that actually we absolutely do need to pick up if we're focusing too much on the prevention. Um, do you think time's the only thing, or do you think there's other things as well, Cal?
Yeah, I did. I published a paper on this, Tim. So I'm delighted you've asked. So time, uh, lack of resources and support, a lack of knowledge, and then financial remuneration or a lack thereof. So they're the kind of four big barriers. Uh, I think uh, those last three are much more addressable, and actually, I think kind of leaps and bounds are being made there. Uh, in terms of resources, things like Moving Medicine are doing a wonderful job at providing resources and support. In terms of knowledge, there's lots of mandates to include these things within undergraduate curriculums of healthcare professionals at the moment, and uh, finances is probably the area we fall short, but there's no money anywhere. So so yeah, but yeah, again, it's interesting. You know, QOF at one point, smoking cessation advice was included within QOF payments, so it's not totally unforeseeable that other lifestyle measures could or should be included.
Yeah, yeah. Okay, that's great. Thank you so much. And I suppose the other thing I'm just wondering about is Yeah, you mentioned it. You alluded to kind of the health coaching piece as well.
Mhm.
So what's your thoughts in terms of how health coaching then might support people? So GPs have limited time. So where might health coaching kind of come in, do you think?
Yeah, I think there's a couple of things here. And the first is that knowledge of physical activity or the prevention thing that you want to deliver is one thing, but knowing how to deliver it is equally important, if not more important. So knowing how to deliver it, which is a key part of what you do. But actually the biggest thing I think from a health coaching perspective is knowing when to deliver it, is being, we are limited in time. We have to be judicious about when we use that time, and who is going to be the best candidate for receiving that advice. And so, I think that from a health coaching perspective, that's probably the key thing, I think, in my mind, is actually, choosing the right moment to kind of offer advice, or choosing the right advice to offer in that moment. So I think that is a really key part, and that's a really key thing that we should be trying to teach health professionals of the present and the future.
Yeah, it's interesting, isn't it? That kind of word advice? Because in my head, when I kind of hear the word advice, what I imagine in my head is I'm adding advice to someone's thinking while I do my thinking on them or on their situation. And that think actually, is that what people need? Is that what people need? Or actually, what do they what they may need is really good information. And I
Mm,
think sometimes as healthcare professionals, we think it's our job to give advice, and that's what people come for. That's what people ask for. And I also think we sometimes feel it's our job to download everything we know about something to someone. But actually, what you know and I know is that lots of people come to see us. They're already up to here, aren't they, with everything? And us downloading what we know about something is unhelpful.
mm,
So it is exactly that, as you've said. It's what's the information that people need, and and how can I present it in a way that they can absorb it and make use of it? Because actually, if we're just downloading stuff, it doesn't go anywhere, does it? That's my
yeah.
experience.
Yeah, absolutely. Kind of tailored and personalized is the key to these things, and making sure that people know it's for them, not
Yeah,
just a kind of copy and paste model.
agree. So you have social prescribers there, Cal, but you don't have health coaches. Is that right?
Yeah. So with us in Scotland, we social prescribers are commonplace. Health coaching less so, I would say, and we actually, through Healthiest Town, managed to get some funding to employ a health coach to work within the practice. Sadly, with all these things, that isn't the case at the moment. That might come back, but that was something we managed to have for a couple of years, which was brilliant to have.
And I suppose that's one of the things that I would be thinking that, would take some of the pressure off, the GPs if they had other people that could do some of that health coaching work. I think GPs and healthcare professionals have a role in setting up those other colleagues really well, and I suppose making sure that we are singing from the same hymn sheet. So if someone's just giving advice and downloading information, and someone else is asking them, "What do you think?" and how might you kind of think how you might work through this situation yourself, they're two different things. So
Mm.
yeah, yeah,
Yeah, multidisciplinary team working, I think, is key. And I was recently lucky enough to travel around the world to look at different models of delivering physical activity promotion. And in Taupo, which is in on the North Island of New Zealand, they had a really interesting model, which was basically GP signposted. Or primary care, I should say, more broadly, signposted to a service which was led by health coaches, and so the health coaches were the first point of contact. They spent a period of time with the patient, and they basically made a plan, kind of found out, well, what does the patient want to do? What's their greatest need? And then from there, we're able to kind of direct resources that the patient might find most beneficial. And so within this multidisciplinary team, there was the health coach, which was the first point of contact, but then there was nutritionists, there was physical activity specialists, there was psychologists, yeah, there was a range of other professionals in there, but the kind of the gatekeeper was the health coach. And a couple of learning points from there is I think first of all, it needs to be individual led, and so kind of having a health coach as a gatekeeper was a really cool example. And the other thing that was really interesting and kind of dawned on me in that process is that actually thinking of singular issues is slightly reductionist. You know, thinking of physical inactivity as a problem in isolation isn't that helpful, because you know people often come with multiple issues, whether it's physical inactivity, uh, whether it's nutritional deficiencies, whether it's you know being overweight, you know alcohol, whatever it might be. And so you know by making it a single issue, it's probably not that helpful.
Yeah. In fact, I was having a conversation with someone recently about that they were kind of thinking about putting health coaches in workplaces, and they were wondering, you know, should we have a health coach who's for sleep and one for activity and one for kind of weight loss? And I was thinking, well, actually, the beauty of a health coach is that they're generalists. Do you know what I mean? That they can absolutely support anyone, whether it's with their mental health or with their sleep or whether it's their chronic pain or their diabetes. And I suppose the other point is that who has one of those things that's going wrong? Often they all overlap and they all interlink with each other.
And we work, the way our brains work is quite iterative. And so we might think that the issue is one thing, and then we sit down with a health coach and talk through things, and suddenly we realize, oh no, maybe this is the bigger thing I need to deal with.
Yes, and often, you know, with that comes up in supervision quite a lot. You know, people will come and they'll be referred for weight loss, but of course, it's rarely ever just weight loss. I mean, there's a whole load of stuff which is going on, I suppose, for people. And again, that's what health coaches with appropriate training and remaining in the scope of their practice. But that's absolutely what they can support people with. Now, this is a bit of a risk, Cal, because you've done two. I think you did 2 days of our health coaching program, didn't you? So
Yeah,
I'm
yeah,
going to
yeah,
put
yeah.
you on the spot a little bit. And so, what did you take away from that in terms of your clinical practice?
Yeah, absolutely. I think I'd done a bit of health coaching before, it. But the biggest thing was was just acknowledging at which stage of change people were in, and
Mm,
so offering targeted support. And Tim, I think it was your question which I loved, and I've used and taken on, which is uh, what are you doing to look after your health? Is such a great opening gambit, because it gives a real indication of 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 where people might be at. Does that make sense? So yeah, I think that would be. I always try to credit you. I can't remember if it was you or Ollie, but I always try and credit you. But yeah, I think that's a really great way to kind of open a conversation about lifestyle or whatever it might be. Really.
yeah, that's it. It was Ollie's question actually, so you do have to start
Ah,
crediting Ollie.
sorry, Ollie. Yeah,
I don't
Tim, you
mind
might have had a lot
taking
of
it.
credit for this.
I don't mind taking it, but yeah. I mean, that was again, it was trying to tune in, wasn't it, to kind of someone's confidence, knowledge, and skills in terms of how they were, you know, how knowledgeable, confident, skillful they were to manage their own health
Yeah,
and well being. That was the point of the question, and therefore, by asking that question, you could really quite quickly get an idea about is this someone who takes their health really seriously and prioritizes it, or for lots
yeah,
of good reasons, is it their health and well being is way down the list of priorities and therefore you can have a different conversation with them. You know, I suspect,
yeah,
ideally.
yeah,
Yeah.
absolutely.
Okay. And I suppose what gives you the biggest hope at the moment for primary care in where you are in Scotland, Cal? What gives you the biggest hope at the moment?
I Oh, good question. Maybe reframing that. The thing that I love most about my job is the people. I think people are amazing. They have wonderful stories, and you know we're all kind of striving in the same direction. We all want better health for everyone, don't we? And so, uh, one of the things that I've been really kind of interested and passionate about is in our community is that drive for kind of community health. Like, what does that look like? I suppose it's it's similar to neighborhood health, but yeah, there's a famous poet from America called Wendell Berry. He talks about the the health of an individual is a contradictory in terms, because I cannot be healthy unless the people around me are healthy, because they determine my health to a certain extent, whether it's family, friends, or the wider community. And so investing in that. So yeah, and on that note, I think that the neighborhood health, I think, look, I think a lot of it needs to be refined, and obviously it's not that relevant to me up here, but I think it's a cool start. I think it's a really cool direction of travel, and I hope it can be shaped in a way which really speaks into the need for kind of communities to come together and strive for good health. And but yeah, that would be my that would be I think there's a lot of hope. Yeah, I'm positive.
Yeah, no, you come across very positive. I mean, it reminds me of the work of Cormac Russell. I don't know if you come across Cormac, but
Yeah, I have come
yeah,
across Cormac. Yeah, yeah,
yeah, the asset-based community development. And
totally.
again, I remember we had some conversations early on, but he was talking about actually the health of individuals being a product of the health of that community.
Hmm.
That's one of his big things, and I think that's so important. I suppose, yeah, the kind of the neighborhood working and it seems very a positive a positive step forward, doesn't it, for that?
Mm. Yeah, yeah, absolutely. And I think look at change. Yeah, we go. I went to medicine to try and make a positive change, but I think sometimes the way to make the most changes is by engaging with politicians in some capacity, Joe. And I don't necessarily like going into politics, but a local academic inspired me to go and meet my local MP and lobby, because as health professionals, as members of the community, regardless what role we have a voice. And so if we're passionate about improving health, we should take that passion to the people of power, and in our case, that's our local MPs and MSPs.
Yeah, agree. Well, I really appreciate you doing that advocacy. That sounds really important work. And what's next then for you, Cal? And I suppose what's next for Aberfeldy?
uh, and I make this all up as I go along, Tim. I just follow my passions. I don't know what's next. I really don't. As we were talking just before we went live, we've just had our second kid, and so definitely, uh, look, life is viewed through a different lens, and trying to carve some space for family time is important. So, so yeah, and maybe I should have done that when you asked me to introduce myself. The way we introduce ourselves speaks volumes of what our priorities are, and I probably should have started by saying I'm a husband and a father as the opening gambit. So anyway, forgive me for that. I'll do that in the future. So yeah, and in terms of Aberfeldy, look, I think our biggest challenge with a lot of health promotion, but in Aberfeldy, we notice again and again is ensuring that we do it in a social equitable way. And so uh, that's something that we are trying to do, we strive to do, but we can still make progress in. And so yeah, just constantly refining and reviewing what we're doing, and just hopefully becoming a community of health.
Yeah, and are people coming to see you and kind of find out what's going on there locally? Because it feels really inspirational. I know there are other places kind of doing this kind of stuff, but it feels such a deliberate kind of aspiration to kind of be the healthiest town in Scotland. I mean, it seems, yeah, you're aiming high, which I think is just great.
Yeah, we wanted to have a race for the top. It was a kind of a bit tongue in cheek, really. Yeah, do we intend to inspire? Not really. We've been inspired by others. What happens in Froome, for example, is a really wonderful kind of inspiring thing, and there's community groups all over the country. So yeah, if we inspire, great, but it's definitely not. It's not why we do what we do.
Yeah, nice one. Well, look, I mean, we're coming to a close now, which is sad, but I'm gonna just check. Cal, is there anything else you want to share before we kind of come to my last question? But is there anything else you want to share about the
Oh,
work that you do?
and I don't think so. I don't think so, Tim. I think, yeah, it probably all sounds a bit better than it is. I'm not sure how much impact some of it has.
Okay. Well, look, well then I'll finish with this question. So what's one thing then, Cal, that you would like every clinician to do kind of tomorrow in their normal kind of day-to-day job that would promote physical activity, what would you have them do, I suppose?
Focus on themselves. I think that's the most important thing. What we know is that active health professionals make active patients because they're much more likely to prioritize it in their conversations. So yeah, be active and when one thing that I heard an environmental doctor talk about was that actually advocacy only matters if you then talk about it or make it visible. So be active and be visible. That would be my my one piece of advice, or two, if that's, I don't know, that's probably two.
Right. So me going on and on about the fact that I do cold water swimming on a Monday morning, I should carry on doing that, Cal. Is that what you're saying?
100%. Yeah, even if people get annoyed, yeah, tell them it's good for their health. Yeah.
Yeah, exactly. It's like that kind of saying. So how do you know if someone's a cold water swimmer? Don't worry, they'll tell you. It's
Yeah,
kind of one of
yeah,
those.
absolutely. Yeah.
Nice one.
So
Great. Well, it's been really good to kind of catch up with you, and I appreciate all the work that you're doing. And I know you kind of you're very self-deprecating. You think, well, actually, I'm not doing much, but I think, through your podcast and through the research you're doing and all that kind of work, you're just raising the profile and the importance of physical activity, but also about how do we engage people in their own health and well-being, and movement. Let's say movement rather than maybe exercise is the key, isn't it?
yeah. Well, thanks, Tim. That's kind of you. Yeah. My greatest attribute is enthusiasm, pathological enthusiasm, rather than anything else. But yeah, I hope so. And yeah, I hope if one person moves more, then it's a job well done, I suppose.
Nice one. Great. Lovely, Cal. Thanks for your time today.
Yeah, pleasure. I hope you get in the water soon, Tim. Won't be
Yeah,
that
don't you
cold
worry.
anymore. Nice and warm.
Don't you worry. Exactly. Exactly.
Yeah.
Thanks so much. Okay. Bye.